immunodeficiency disorders like SCIDS, severe combined immunodeficiency, and we'll cover Lesch-Nyhan syndrome today. We'll cover gout, right? So first of all, I will start with gout. So let me start with gout. Right? What is gout? Right? It is basically overproduction of uric acid, right? And how will you define what is uric acid? It is the end product of purine metabolism, right? Uric acid is end product of purine metabolism, right? And gout is due to overproduction of uric acid, right? Now let's start with the normal levels of uric acid in males and in females, right? In males the normal value is 3 to 7 milligram per cent, right? And in females the value is 2 to 6 milligram per cent, right? So I repeat, gout is due to overproduction of uric acid. And what is uric acid? Uric acid is end product of purine metabolism, right? Normal levels of gout is, uric acid in males is 3 to 7 milligram per cent, and in females is 2.6 milligram per cent. And now one question again, who are more susceptible to gout? Males or females? Males. Yes, males, they are more susceptible to gout as compared to females, right? But in postmenopausal women, right, postmenopausal, they are susceptible, right? Males, they are more susceptible as compared to females, but in case of postmenopausal women, they are susceptible, right? It's okay. And what causes gout? One thing we discussed, overproduction of uric acid, right? And what leads to gout? What leads to gout? Any guesses? 70, can you guess what can lead to gout? 70? Yes, please. Any guesses? What leads to gout? It is a disease that is caused due to high living, overeating, and high alcohol consumption. High alcohol consumption, right? So you can also say it is a disease of the rich people who overtook alcohol or overeat or they have high living, right? It can lead to these symptoms, right? Anything left in gout? Gout is due to overproduction of uric acid produced by end product of purine metabolism, that is uric acid, right? Normal levels are this, and males are more susceptible to gout than females, but postmenopausal women are susceptible, right? And it is caused maybe due to high living, overeating, and high alcohol consumption, right? Clear up to this or not? Tell me. I continue now. And what are the types of gout? Gout has two types, right? Gout has two types. One is primary gout and second is secondary gout. Clear up to this? And primary gout, the reason is purine metabolism. The disorder is due to any defect in purine metabolism, which we discussed in the previous class, right? And the secondary gout is due to other reasons. Then purine metabolism that lead to high uric acid levels. Right? Primary means it is concerned with the primary reason. Right? Primary reason is it is formed in the purine metabolism uric acid. So whenever disorder is being precipitating due to this metabolism, proper purine metabolism, it is known as primary gout. Right? But in case of secondary, the reasons are secondary. It is not purely associated with purine metabolism, but there are some other reasons that may lead to increase in uric acid and the symptoms. Right? It is secondary gout. High uric acid levels are there, but they are due to other reasons than purine metabolism. But can be the reasons, it can be cancer, right? It can be psoriasis, skin disease. We'll discuss them in detail after this. So I will start with now primary gout, right? Primary gout, right? And one thing more, how will you diagnose gout? How will you diagnose gout? If a patient, what is the most confirmatory test for this gout? And it affects which major part of the body? First, metatarsophalangeal joint, right, of the great toe, right? And some they are having wrist issues, and some are having ankle joint problem and knee joint, right? They are major organs that are affected, right? And when you aspirate the fluid from the joint, aspirate it contains sodium urate crystals. So it is the confirmatory diagnosis, right, for uric acid increase in and deposited in joints causing gout problem, right? Now I will start with primary gout. Primary gout is associated with which metabolism or which proper anything? How will you define? So primary gout is there. Right? We discussed purine metabolism in the previous class, right? It has total 11 steps. Debarma, please stand up. Can you please revise me the 11 steps or not? Just giving up. Division, can you try? Himani, can you try? 11 steps. Samya, can you try or not? Or giving up? Okay, give up. Let me finish the topic. So primary gout is associated with purine metabolism, proper, right? Right? So there are main 5 enzymes. First is PRPP, synthetase. The first enzyme, glutamyl amido transferase. Third is HGPRT deficiency. Fourth is glucose 6 phosphatase deficiency, right? And the fifth is glutathione reductase. So these 5 are associated with primary gout, right? You follow in this manner, it will be easy to remember. Keep on taking screenshots, it will be easy for you. But after that, you will not be able to, if you go through Satyanan, it is difficult to remember as well Vasudeva. So follow this order, I will help you very well, right? So this is the first step. Phosphoribosyl pyrophosphate is formed. Then the second step, and this is HGPRT. It was involved where? It was involved in salvage pathway. These two first were involved in de novo synthesis, and this was involved in where? Salvage pathway. And this glucose 6 phosphatase, this is another enzyme, and this is glutathione reductase, right? You have taken screenshot now. I will start with individual enzymes and how they cause gout or increase in uric acid levels, right? This is increased, this is increased, this is decreased, this is decreased, right? in gout, right? So first of all, I will start with this enzyme, glucose 6-phosphatase deficiency, right? Glucose 6-phosphatase, right? What will it do? It will convert glucose 6-phosphate to glucose. It's clear up to this now. Be alert in this class, it is very important, right? So glucose 6-phosphatase. Age that break down glucose is glucose 6-phosphatase is glucose 6-phosphatase, right? So the step was glucose 6-phosphatase is acted upon by glucose 6-phosphatase to form glucose, right? Now what is the problem? There is deficiency of this enzyme. Be clear now, don't talk. Glucose 6-phosphatase deficiency is there. So what will happen? The level of enzyme is low. Fourth step, right? So this glucose 6-phosphatase will not be converted to glucose because we have deficiency of this enzyme glucose 6-phosphatase. Are you able to get it or not? Be alert. Glucose 6-phosphate is acted upon a glucose 6-phosphatase to form glucose. It was discussed in carbohydrate metabolism, right? But this enzyme is not there because there is deficiency. So this glucose 6-phosphate will not be broken down to form glucose. So this will increase glucose 6-phosphate, right? And what is the function of glucose 6-phosphate? It is precursor for HGPRT shunt, right? And from HGPRT shunt we form ribose 5-phosphate. And what is ribose 5-phosphate? It is precursor for de novo synthesis, right? From high ribose 5-phosphate we will form IMP via de novo synthesis, right? And this IMP will lead to synthesis of purines. The purines level will increase and it will break down as well. Breakdown will form more uric acid, and high uric acid will lead to gout. It is all interconnected now. We are into the fourth metabolism, but we are starting from the first metabolism, that is carbohydrates, right? So see, there is deficiency of enzyme glucose 6-phosphatase, right? So glucose 6-phosphatase is acted, glucose 6-phosphate act करेगा, glucose 6-phosphatase तो बनेगा glucose. But due to deficiency of this enzyme, glucose 6-phosphatase is not broken down to form glucose. Phosphatase that break down 6-phosphatase, glucose 6-phosphatase. ACE that break down, lipase break down lipids. ACE that break down glucose is glucose 6-phosphatase, right? So glucose 6-phosphatase is not really broken down to form glucose, so it will accumulate due to deficiency of this fourth enzyme, right? So when it will accumulate, it will enter HMP shunt because it is precursor for HMP shunt. From HMP shunt it will form ribose 5-phosphate. Hope you remember we did the mnemonic in the first class. घर पे पापा रहेंगे, vacation पे जाएंगे, that was HMP shunt, right? From HMP shunt will form ribose 5-phosphate, right? And ribose 5-phosphate is precursor for de novo synthesis that we did in the previous class. From de novo synthesis we will form IMP, then purines, and then purines will lead to formation of, when they will break down, more purines will be formed, more they will be broken down to form uric acid. So uric acid level are going to increase causing gout, right? Now coming on to these two enzymes. These are the first two steps. You have taken screenshot, please take screenshot. It will help. Now these are the first two steps. What is the steps of de novo synthesis? We start from ribose 5-phosphate. Tell me, I am wrong or right? Yes. Then we form PRTP. Then we form 5-phosphoriboside amine. Right? So this was the first step. The enzyme was PRTP synthetase. Right? and this PRP is converted to 5-phosphoribosylamine by PRPP glutamyl amidotransferase. Right? These are the first two steps of purine synthesis, right? Where it is highly regulated, right? This is the first step and this is the second step. First step, synthetase is there. So what is going on? We are adding ATP. I told you 1, 3, 5, 7 and 6 and 8 the steps contain ATP synthesis. The enzyme is synthetase always, right? So this is the first enzyme, this is the second enzyme. What happens here? That cause high uric acid levels. Any guesses? Both these enzymes are under feedback regulation, right? But this delicate feedback is not maintained due to these high levels of these enzymes, right? PRP synthetase is increased, glutamyl amidotransferase is increased. The first two steps, right? When the levels of enzymes are increased, the reaction will move forward. Will it move forward? Yes. What will happen? Finally will form IMP, and IMP will form other purines and finally will form uric acid. Uric acid will increase, that will cause this gout. And PRPP synthetase is there and it is both are under delicate feedback control. But it is not maintained due to high levels of both these enzymes, leading to increased synthesis of IMP and finally uric acid. So uric acid will increase, it will cause gout. Why primary gout? Because it is associated with purine metabolism. Secondary we will discuss later on. So I repeat, first was the enzyme glucose-6-phosphatase deficiency. Starting from the fourth step, glucose-6-phosphatase is the glucose-6 enzyme that breaks down glucose-6-phosphate. So glucose-6-phosphatase deficiency is there. So we are not able to break down glucose-6-phosphatase to form glucose. So this glucose-6-phosphate will accumulate and this glucose-6-phosphate will increase. This high glucose-6-phosphate will enter HMP shunt. From HMP shunt it will form ribose phosphate, and from ribose phosphate it will enter where? De novo synthesis and finally will lead to uric acid synthesis. So this is clear, and these two are under feedback control where high levels disturb the balance of this feedback control and ultimately lead to synthesis of high uric acid. Now coming on to the third, that is HGPRT deficiency. Where this enzyme is used? HGPRT. Palak Yadav, you are not okay? You want to leave, you can go if you are not feeling okay. The third enzyme is HGPRT deficiency. HGPRT deficiency. Where this enzyme is involved? In salvage pathway. Now we are having deficiency of this enzyme HGPRT. What will happen? What will happen? Third is HGPRT deficiency, right? Now we are starting with HGPRT deficiency, and it is enzyme of purine salvage pathway, right? What was salvage pathway? Anybody who knows? Anybody? Hypoxanthine and guanine. They were directly converted. That was why the name was salvage pathway. Now, due to deficiency of this enzyme, this pathway is blocked. Right? So they will hypoxanthine and guanine, they are not converted into respective nucleotides. So what will happen? They will accumulate. Right? What will happen when they accumulate? Salvage pathway is not operating. So what is the major pathway? De novo synthesis. They are diverted for de novo synthesis and PRPP and second enzyme both are already high. So ultimately will lead to synthesis of more purines. More purines will lead to more synthesis of uric acid. More uric acid will lead to more gout. Clear or not? It is difficult, I know, but I know you have not remembered this previous pathway. That's why I was able to get it. So you have to remember the previous pathway, then it is easy. Otherwise it is going to be very difficult. Right? So I covered the first two enzymes, HGPRT deficiency and glucose 6-phosphatase deficiency, and now glutathione reductase. What is glutathione reductase? Madhurima, you are doing something else. What is glutathione reductase? Tell me where this enzyme is involved, glutathione reductase. Any guesses? It is involved in HMP shunt, right? So what will happen? What is going on? Deficiency or high levels of glutathione reductase? Just tell me first. There are increased levels of this enzyme. So what will happen when the levels will increase? High glutathione reductase right will lead to synthesis of more NADPH. And more NADPH form, how they are metabolized via more they will enter HFP shunt. What will they do? They will form more ribose 5-phosphate. And when ribose 5-phosphate is there, we will have more de novo synthesis. And de novo synthesis will happen, what will lead to synthesis of IMP, and IMP will lead to synthesis of further purines, and these purines will, when degrade, they will form more uric acid, and ultimately high uric acid will lead to gout. So all the 5 factors are covered now. Any guesses are there? Any doubts are there? You ask me, or otherwise if you need repeat, I repeat, otherwise I will go for questions first. Yadav is where? Absent today in class. Where is Yadav sitting? Yadav, you were sleeping. So, I repeat, just to revise. First of all, right in this order, start with fourth enzyme, glucose 6-phosphatase. Glucose 6-phosphatase is there. ACE, glucose 6-phosphatase, that breaks down glucose 6-phosphate to form glucose. Right? So due to deficiency of this enzyme, glucose 6-phosphatase, phosphate is not broken down to form glucose. So it is not broken down, the level will increase. The level will increase, it will enter HMP shunt. When it will enter HMP shunt, it will lead to synthesis of ribose 5-phosphate. And ribose 5-phosphate will enter de novo synthesis because it is precursor for de novo synthesis. So de novo synthesis will happen, it will lead to synthesis of more purines. More purines will lead to synthesis of more uric acid. Right? So first thing is done, glucose 6-phosphatase deficiency. Second was glutathione reductase, and glutathione reductase is increased. When it is increased, what will happen? It will lead to synthesis of more NADPH, and NADPH will cause metabolize via HMP shunt, and from HMP shunt they will again form ribose 5-phosphate, then again purines, and then again uric acid. All these two done, and the first two are the first two steps of de novo synthesis. They are under feedback control, but the delicate feedback is not maintained due to their high levels. So ultimately, the high levels will lead to synthesis of more IMP and more uric acid. So it is done. And third is HGPRT deficiency, right? This is salvage pathway enzyme. This enzyme is decreased. That will lead to less conversion of hypoxanthine and guanine to the corresponding purine. And hypoxanthine and guanine, when not converted by a salvage pathway, they will enter into de novo synthesis. and from de novo synthesis, more uric acid. More uric acid, primary gout is covered. So this covers the primary gout. Now I will start with secondary gout. What is secondary gout? Gout. First, name the symptoms. Symptoms are that the levels of uric acid increase. What can other factors that can lead to increased uric acid are? First is chemotherapy. Write down the factors that lead to secondary gout. First is chemotherapy. Second is cancer. Cancer may be leukemia or lymphomas, both. Revision, you need water. Okay. Third is psoriasis. Fourth is renal failure. And fifth is high alcohol intake. Right? Primary gout was associated with the 5 enzymes of purine metabolism, and the secondary gout is associated with the other factors excluding purine metabolism that can lead to increased uric acid in the body. They may be psoriasis, cancers, lipomas, and leukemia. High alcohol intake. Anything left? Yes. Okay. So now coming on to the next topic, some immunodeficiency disorders. And what is the drug that is used to treat gout? Major drug that is used to treat gout. Allopurinol. That is the major drug that is used for treatment of high uric acid levels. Right? So where does this drug target? It acts as a competitor inhibitor of enzyme xanthine oxidase. We discussed it in breakdown of purines, right? So ultimately there is suicidal inhibition of this xanthine oxidase, proper. Suicidal inhibition is there. That will block the synthesis of uric acid and the levels will increase. So major drug of choice is allopurinol. And if someone has more pains, you can give painkillers as well. Right? What is pseudo gout? Next, what is pseudo gout? We discussed primary gout, secondary gout. Now coming on to the pseudo gout. Pseudo. What does the name indicate? Pseudo. False, jhutha. When it will happen? The clinical manifestations are similar to gout. The clinical manifestations it is totally similar to gout. But there is some difference. What is that difference? That is why it is called pseudo gout. So there is deposition of calcium pyrophosphate crystals. Calcium pyrophosphate crystals. In gout, the crystals were sodium urate. And here calcium pyrophosphate crystals are being deposited that are mimicking the gout symptoms, but it is not a gout, hence the name pseudo. Pseudo means jhutha, pseudo gout, false gout. But symptoms are, the manifestations are similar to gout. But deposition of crystals is calcium pyrophosphate in place of sodium urate. Right? And the crystals that are deposited in joints, what are the name? Tophi, Tophi. that cause pain. They are sodium urate crystals. When they deposit in joints, they cause pain, and these crystals are known as tophi, T-O-P-H-I, tophi. Youngong yawning in my class. Now we'll discuss the next disorder, that is, so gout is finished now. Now we'll discuss Lesch-Nyhan syndrome. You will get minimum 5 marks question from complete gout. If I am the paper setter, I will add it. There are the 4 major questions in this chapter. One is you are given is big note on steps of de novo synthesis. Then 5 marks will come under salvage pathway or regulation along with that, right? And the third question is proper note on gout, 10 marks. Proper note on gout in which you write primary gout, secondary gout and all that. Okay? And the third question that will come in PG as well, that is I am going to discuss Lesch-Nyhan syndrome, severe combined immunodeficiency, the 3 disorders. Out of these 3, one will come in PG as well, and they can also ask you in Bio as well, right? So let's start. First of all, Lesch-Nyhan syndrome. Lesch-Nyhan, what does it indicate? Lesch-Nyhan. And how it is manifested through deficiency of enzyme HGPRTase. And this enzyme is used where? In salvage pathway. In PG you will get 4 enzymes, 4 disorders, and this will 100% come. In pediatrics paper it will 100% come. My promise. After 5 years you will get this question, right? Salvage pathway enzyme is there, HGPRT deficiency. So what will happen? How was the name derived? Lesch-Nyhan does indicate Michael Lesch was a medical student, and he was the student Nyhan, that both of them associated to form this name of disorder. So name was Lesch-Nyhan syndrome, right? And it is only in males, not in females. So females are blessed in this case, right? And how will you identify it? First is that it is through deficiency of HGPRTase, right? And it is a metabolic disorder, and the enzyme is located on the X chromosome. Right? So what will happen? And HGPRTase deficiency is there. We discussed in gout that HGPRTase deficiency will lead to high uric acid levels. So the symptoms of gout will club with it. The symptoms of gout will also come in this disorder now, because this is deficiency of this enzyme, and this enzyme is associated with salvage pathway, and deficiency of this enzyme will put the pathway toward de novo synthesis, and de novo synthesis will lead to synthesis of more uric acid, right? So this deficiency will lead to high uric acid levels. So symptoms will come in this disorder as well, because the deficiency of enzyme is this, right? And it is linked to X chromosome, and it happens only in male child, right? And other symptoms, there is excessive uric acid production, and there is gouty arthritis. Write down, gouty arthritis is there, and there are some neurological abnormalities as well. Neurological. Any guesses? First 2 we had discussed: high uric acid levels, gouty arthritis. Here, aggressive behavior is there. right? Mental retardation is there, low IQ is there, low IQ, and self mutilation is there. Self what will happen is the child will irresistible urge to bite his fingers. He will bite his fingers. I will share you video as well. I have some video of the disorder. Some of my old students sent me. That is you will when you see the child, you will get the clear symptoms of this. Aggressive behavior is there, mental retardation is there, low IQ is there, self mutilation. The child will have when the child will come to in OPD, right? He will bite his fingers, bite himself, right? And he will have some aggressive behavior, and IQ score will be very low. And first of all, when the girl child is there, you will totally exclude that it's not a Lesch-Nyhan syndrome. Done. But it is only due to X chromosome, it is only in males. Right? Right? Clear? And the symptoms mask with symptoms of gout as well, because it will have high uric acid level, gouty effect, because the enzyme is same. HGPRT deficiency is there, so it is enzyme of the salvage pathway. This enzyme is not there, so the purines are diverted for de novo synthesis. So de novo synthesis will move more, it will lead to more INP and more uric acid. Right? So that causes Lesch-Nyhan syndrome, and something left in Lesch-Nyhan syndrome, let me check. There is learning disability as well, mental retardation, aggressive behavior, right? And patient has irresistible urge and to bite his fingers, right? High uric acid levels are there, gouty arthritis is there, right? And some disorders left now. They are immunodeficiency disorders. One is SCIDS. They will also come in next year in microbiology. They are immunodeficiency disorder. I discussed it in the immunology part as well. So the first is SCIDS. SCIDS. Severe combined immunodeficiency. Severe combined immunodeficiency. Right? And the second one is any guesses? Purine nucleotide phosphorylase deficiency, right? So two major enzymes involved are, any guesses? First is this and second is ADA, adenosine deaminase deficiency. One is due to adenosine deaminase deficiency, second is due to purine phosphorylase deficiency. So first disorder is SCIDS. SCID is severe combined immunodeficiency. Severe combined immunodeficiency. Right? So what will happen in the absence of these enzymes? We had discussed purine metabolism, right? Any guesses? Tell me, what will happen when we are having ADA deficiency? First enzyme, ADA deficiency. And there is complete T cell T and B cell dysfunction. There is complete dysfunction of T cells and B cells. Severe combined immunodeficiency disorder is there. Deficiency enzyme is adenosine deaminase. Adenosine deaminase. So what will happen? What will happen? The deficiency of this enzyme will lead to accumulation of any deoxy ATP, sorry, deoxyadenosine triphosphates. So what will happen? Any guesses? I given a hint now. Deoxy ATP. Any guesses? And it is inhibitor of enzyme ribonucleotide reductase. Now can you guess now where this enzyme was involved in the previous class? It helps in formation of deoxyribonucleotides. So we are not forming now deoxyribonucleotides. So what will happen? DNA proper will not be formed, DNA synthesis will not happen. So what will happen? Here combined immunodeficiency. Right? So it is deficiency of adenosine deaminase, clear? Both T and B cell dysfunction is there, and ADA deficiency results in accumulation of deoxy ATP, which is an inhibitor of enzyme ribonucleotide reductase. Since ribonucleotide reductase is not formed, so it will interfere in synthesis of DNA and cell replication, so immunity is compromised, right? The second disorder is purine nucleotide phosphorylase, this one. Purine nucleotide phosphorylase deficiency. What will happen here? There is some form of less curse is there or more curse is there in this disorder. It is associated with impairment of T cell function. In that disorder, both T and B cell was there. Here only is T cell function, and there is no effect on B cell function. Only T cell function is not functioning proper. Uric acid level is decreased in this disorder. Write down, uric acid is decreased in this disorder. Right? Purine nucleosides and nucleotides are higher. Right? Purine nucleosides and tides are higher in this disorder, and it is believed that deoxy-GTP inhibits development of normal T cells are not there. Normal T cells are not there. In this disorder, there was both T and B. Which was that? SCIDS, severe combined immunodeficiency. In this only, second one, there is only this is affected, right? So today we covered gout. Gout was of two types, primary and secondary, right? And the symptoms of gout, that treatment of gout, and factors how to distinguish, right? Then we discussed Lesch-Nyhan syndrome. Lesch-Nyhan syndrome was a medical teacher and a student, they diagnosed it, and the name was given Lesch-Nyhan, right? And it affects only males, X chromosome is there, right? And this disorder is associated with neurological manifestation, like aggressive behavior is there, mental incapability is there, low IQ is there, and the child is very aggressive and has irresistible urge to bite his fingers and nails, right? So it will harm itself, right? And if there is a female child, we totally rule out that there is no Lesch-Nyhan syndrome, right? And the symptoms are due to HGPRT deficiency, so the same enzyme that leads to increased uric acid, right? So the symptoms will club with high uric acid levels, that is gout. The gout symptoms are already in this disorder, that is high uric acid levels and pain in joints and other, right? But you will differentiate it with mental incapabilities. When you see the child, he will be biting his fingers, he will have aggressive behavior, he has a low IQ, right? And the third, fourth disorder was severe combined immunodeficiency and nuclear phosphorylase, right? And in one disorder, severe combined both T and B cell deficiency is there, but in the second, there is only one cell deficiency is there, right? And severe combined immunodeficiency disorder. What was the problem? We are not able to form deoxy sugars due to deficiency of deoxy wala, right? So what will happen? We will not be able to form proper DNA and further synthesize and replicate it. So there is deficiency and severe combined immunodeficiency. There is a immunodeficiency disorder is there, right? The second was nuclear phosphorylase, purine nucleotide phosphorylase. The enzyme was leading to T cell impairment of only T cell, not B cell, right? In MCQs, when you will give the exam in PG, this disorder will be complicated. Only T cell is there, both T and B cell is there, so you have to differentiate this, right? And in this case, there is hyperuricemia. Hyperuricemia is there, right? And if all the three disorders are given, in case of Lesch-Nyhan syndrome, you will have hyperuricemia, and in this disorder, you are having hypouricemia. You have to differentiate and write down picture of all these points, right? So that finishes the today's chapter. So in next class we will do pyrimidine metabolism breakdown, right? So it is a heavy chapter. Please revise it.